I think we have to be aware that we are facing a digital transformation. More and more children are using modern ways of assessing their glucose levels with continuous glucose monitoring. They are using insulin pumps, and the automated insulin infusion is kind of on the horizon. It's not quite there, but using bolus calculators and all kinds of digital means to improve their diabetes care is something that particularly young people with diabetes are very interested in. So on the one hand, we are needing insulin that is very, very flexible. So the ultra-fast insulins are in the development, in clinical development. We have just the first product with faster aspart on the market, also with pediatric trials, which are just being finished and published. So we're looking forward to that. Then ultra-long insulins, U300 insulins, or insulins with a protected form of action are entering clinical practice, and we're getting more and more clinical data on how this is actually helping. And last but certainly not least, most importantly, the intermittent scanning continuous glucose monitoring and also the permanent glucose monitoring is really changing the way that the scope of how to control your glucose and that how to achieve the best time in range. That is really transforming the diabetes care right now. I think through this whole Congress, if you look at it from the perspective of type 1 diabetes, adjunct therapy to insulin is really the thing that I find most interesting. There are presently 3 drugs that are in the preparation to be maybe regulatory approved. One of them is sotagliflozin, a dual SGLT1 and 2 inhibitor, dapagliflozin or empagliflozin, which are SGLT2 inhibitors, which are approved for type 2 diabetes, but now are tested in type 1 diabetes. And really, I think they might make a difference in type 1 diabetes, because again, the glucose swings are smoothened with this type of therapy. A1C is improved, weight is reduced, even positive effects on the renal effects. On the other hand, we have to balance that against the risk of DKA, and so this will be very interesting to see the clinical data which is going to be presented during this meeting of these drugs, how this will play out, but I'm optimistic that this will be a new option for patients with type 1 diabetes.